As you age, you might start thinking about your eligibility for Medicare. Jacqueline Smith is an elder benefits specialist for Waukesha County and helps people through an unknown and what can be a confusing process.
Medicare can be very complex and confusing. Medicare Parts A and B, you apply for those at the Social Security office. A and B are considered original Medicare. Part A is the hospital insurance, and Part B is the medical insurance. So you're eligible for Medicare when you turn 65. So Medicare Part A is free for most people with qualifying work quarters. So as long as they have some sort of work history, either them or their spouse, they qualify for free Medicare Part A. And Part B is the medical insurance, and that costs $134 a month. So there's a $134 a month premium that comes right out of the Social Security check. If they're not collecting Social Security, then they need to pay that to Medicare.
There are many rules about coverage when you're on Medicare. Make sure you know when you will and won't be covered.
If you travel outside of the United States, you have no Medicare coverage. Medicare only works in the United States. There is no coverage abroad or on international waters. So people need to be really careful about going on a cruise on international waters and making sure that they have health insurance in place.
If you are nearing 65 years of age, you still need to register for Medicare, even if you're not planning to use it immediately.
So if you're somebody that maybe wants to work until full retirement age, maybe that's 67, 68, maybe you want to work until you're 70 and start collecting your Social Security benefits, as long as you have credible coverage, you may be able to delay your Medicare. So Medicare is confusing, it's complex. There is help available online. Otherwise, you can call 1-800-MEDICARE to get some questions answered too.
Support for Next Avenue Moments is provided by the Helen Daniels Bader Fund, a Bader philanthropy.